Hello friends, my name is Dr. Basavaraj Sangolli. I am a pulmonologist and I am a nodal officer for tuberculosis since past more than 7 years. Today I am going to give you absolutely important health tips which you should know if you are suffering from tuberculosis or any of your family members or friends are suffering from tuberculosis. So let's start with, we say somebody is having tuberculosis if he has more than 2 weeks of cough. अगर 2 हफ्ते से ज़्यादा खांसी है तो वो टीबी सस्पेक्ट है। उसके साथ उसको कफ भी हो सकता है, he can have sputum production, he can have weight loss, he can have fever which is usually more in the evening times, low grade fever, or he can have blood in sputum, he can have many other symptoms like swelling in the neck and other things. If the patient has just 2 weeks of cough, also he is a TB suspect. अगर ऐसा है तो we immediately subject him to a simple test, that is a sputum test. कफ को निकाल के टेस्ट करते हैं. अगर उस if that sputum test comes as positive for TB, we see whether it is normal TB or a complicated TB. If the normal TB, then we subject him to a TB treatment for 6 months. If it is a complicated TB, for 9 months to 18 months. It depends on what category he falls into. The TB tests and the TB treatment both are absolutely free under government scheme, that is National Tuberculosis Elimination Program, NTEP. The same thing was initially called as RNTCP. ये scheme के under government gives free testing, free treatment and also nutrition support for 6 months. अगर आप आधार कार्ड देते हैं, if you give your आधार कार्ड number and you are registered under government, along with free treatment, government also gives you amount of 500 rupees every month directly into your account via your आधार number. So remember, test भी free है and even the treatment is free if you are registered under government. Okay. Coming to the next important point, that is the 5 important health tips which I want to give if you have tuberculosis. The first most important tip is taking correct course of treatment for the correct duration. Agar if the doctors tell you to take 4 tablets daily morning, then you have to take it daily morning itself and complete course, that is a 4 tablets only. You cannot skip, you cannot reduce the doses, and also you should not skip the doses in between. You should not reduce your duration. If it is normal tuberculosis, we tell according to your weight how many tablets to be taken for how many months. That has to be taken correctly and judiciously. Then your TB will be cured within that said stipulated time. Second most important health tip is nutrition. ठीक है, the most of the patients are very weak, they are fragile. आपका इम्यूनिटी लो है, आप बहुत वेट कम है, इसलिए तो आपको टीबी आया है. You have to eat well, then only you can tolerate the medicines and you will recover faster. What to eat? Have healthy diet, eat everything possible. Okay, have vegetables, have fruits, have eggs. If you eat eggs, boiled eggs are some of the best supplements for proteins. Okay, if you don't eat eggs, consume soya beans, consume groundnuts. You can have groundnuts with jaggery, which is going to give you more calories like proteins also and calories also. It's absolutely helpful. And remember, eggs, when you are consuming, it has to be boiled eggs. Okay, the raw eggs are not at all digestible by your body. It's going to be a waste. Always consume boiled eggs. 1 or 2 boiled eggs per day is sufficient. Third most important point which I want to tell you is avoid smoking, avoid consumption of alcohol. The TB treatment itself is very strong. Your smoking, your alcohol will cause more damage. It can cause more liver problems. So absolutely avoid smoking and alcohol. They are not at all advisable. Fourth important point is to treat comorbidities. Matlab, if you have other problems like diabetes, that is when you acquire tuberculosis. If you have HIV, AIDS, you have to take those treatment. टेक अप डायबिटीज़ का ट्रीटमेंट, टेक HIV का ट्रीटमेंट, अगर HIV है तो HIV का ट्रीटमेंट लो। अगर आपको कोई अदर प्रॉब्लम है, अस्थमा है, कुछ कैंसर है, कैंसर का ट्रीटमेंट लेते हैं। इफ़ यू आर एनी ऑन स्टेरॉइड्स और फॉर एनी अदर डिसीज, यू कंटिन्यू टेकिंग दैट ट्रीटमेंट, डोंट स्टॉप एनी ट्रीटमेंट until advised by your doctor. Okay, coming to fifth most important point which I want to tell you is protecting your family. अगर आपको TB है तो फैमिली में किसी और को नहीं आना है ना, so try to avoid getting TB to others. So how you can avoid? So you have to avoid by following simple sputum hygiene, cough hygiene. It's called as cough etiquette. So what you have to do is, you should remember not to cough on anybody's face, not to sneeze on anybody's face. Use a tissue paper, use a handkerchief, so cover your mouth when you're coughing and sneezing, so that the bacterial particles don't spit out and they don't spread to others. Never ever throw your cough or sputum in your house. Don't spit anywhere. Okay, always have a sputum cup with a lid. Always open the lid, you spit into it, immediately close it. At the end of day, you can flush it off in wash basin or your toilet, or you can go to your garden, dig up a small part of your garden of depth of 5 inches, drop everything inside and cover it up with mud. This is the best and safest and simple techniques to dispose of your sputum. Agar wo sputum, your sputum, if it falls out openly, then there are chances that everybody in your house is exposed to that TB bacilla and they can also get tuberculosis. So remember, you can talk with others, you can eat with others, you can have a chat with them, but don't ever cough or sneeze in front of them and follow cough hygiene. If you want to, if you don't have kerchief and tissue, you can cough inside your shirt or in your elbow. This is the safest way to cough and sneeze. This is called as cough etiquette. Finally, I also want to tell you when to inform your doctor. If you are on treatment and if you are having very bad tummy upset, अगर आपका पेट दर्द हो रहा है, your stomach is aching a lot and you are vomiting a lot, if there is loose motion, you consult your doctor. It could be gastritis, he will give you simple treatment and it will control it. If you have yellowish discoloration, secondly, if you have yellowish discoloration, अगर आपके आंखें लाल पीला हो रहे हैं, your tip of your tongue and your hands and eyes are becoming yellowish in color, there could be some liver problem. So consult your doctor immediately. He will check it and he will give you a dose adjustment, or he will stop the treatment for some time, or he will do whatever according to doctor's prescription. Thirdly, if you have severe rashes, अगर चमड़ी में बहुत ज़्यादा खुजली हो रहा है, रैश हो रहा है, लाल लाल हो रहा है, तो immediately you have to visit your doctor. Okay, the doctor can stop treatment temporarily or he can give alteration and treatment. Fourthly, if you have joint pains, अगर बहुत ज़्यादा joint pains है, if it is a very bad joint pain, go to your doctor. Doctor needs to do some test. If it is very severe, he will need to adjust his dose. Fifthly, if you have blood in sputum, you are on treatment but there is blood continuously coming in your cough. Okay, that is when you have to meet your doctor. He is going to see that blood doesn't come again and it is not going to cause severe problem. Okay, lastly, if you have vision problem, अगर आपको दिखाई नहीं दे रहा है, if there is any problem in vision, then you have to meet your doctor. He'll send to an ophthalmologist or eye specialist and he will see to it that that eye problem is taken care. It's very important. You can also lose your vision if not taken seriously. Now I'm going to tell you when you need not go to doctor. Some basic things which you see commonly and it is not to be worried about. That is, firstly, अगर आपका urine is red color, if your urine is red in color, you don't need to worry because it's a normal color of the drug which you are taking. So it is your urine and your stools, that is latrine, maybe लाल आ सकता है That is the color of the tablet, nothing to worry. Secondly, अगर आपका खांसी और बुखार, if your cough and fever are not reducing immediately, you don't need to worry, because it's a slow treatment. Slowly only all your symptoms will reduce. It will take some time, don't worry, everything will be resolved after some time. Finally, मैं क्या बताना चाहता हूँ, how you can monitor yourself that you are improving at your home. If your symptoms are reducing, your cough is reducing, fever is reducing, plus your weight is increasing, it means you are improving, nothing to worry. Meet your doctor whenever he says to come for follow-up. When you go to a doctor, what he sees, what we see in a patient, if he is improving, that is clinical improvement. वो अच्छा हो रहा है कि नहीं, symptoms कम हो रहा है कि नहीं, that we see. Secondly, microbiological improvement, bacteria कम हो रहे हैं कि नहीं, whether the bacteria are reducing or not. Thirdly, if you are radiologically improving or not, X-ray, CT scan में improvement हो रहा है कि नहीं. This is what we want to see. These are a few points which I wanted to inform you all. So stay safe, stay healthy. If you have any doubts regarding tuberculosis, if you have any thing you want to know in detail, you can comment below and I'll try my best to help you out. This is the video which I have created after seeing so many of my patients having so less knowledge about tuberculosis, and they start immediately crying after knowing that they have tuberculosis. So nothing to worry, it's completely treatable disease. आपको पूरा क्योर हो सकता है, पूरा क्योर हो सकता है अगर आप सही तरह से गोली लेते हैं एंड डॉक्टर्स का एडवाइस फॉलो करते हैं. थैंक यू सो मच. नमस्कार.